Welcome to Dr. Martin Health Tips, where real medical insight meets everyday life. I'm Dr. Martin, and here we uncover the truth about your health so you can live longer, safer, and stronger. Let's get started. If your mother, your father, your grandmother, or anyone you deeply care about over the age of 70 is currently taking certain medications, I need you to listen very carefully to what I'm about to say, because this information could genuinely protect their life. This is not about fear. This is not about exaggeration. This is about reality, the kind I've witnessed firsthand over years of clinical practice, watching older adults walk into my office with symptoms that everyone assumed were just aging, when in fact, those symptoms were being caused by medications that were supposed to help them. Let me tell you something that most people don't realize. Medicine is not one size fits all. What works perfectly for a 40-year-old body can become dangerous, even toxic, in a 70-year-old body. And here's why. As we age, the body changes in ways that are not always visible. The kidneys, which filter waste and medications, begin to slow down. The liver, responsible for processing drugs, becomes less efficient. Muscle mass declines. Body fat distribution changes. Even the brain becomes more sensitive to chemical effects. So what happens? A medication that once passed through the body smoothly can now linger longer, build up, and start causing side effects. And these side effects are not minor. We're talking about confusion, dizziness, falls, internal bleeding, memory loss, sometimes even conditions that mimic dementia. And the most heartbreaking part? These symptoms are often blamed on aging, when the real cause is sitting quietly in a pill bottle. Now, before we go any further, I want to be absolutely clear about something. Do not stop any medication suddenly without speaking to a doctor. That can be dangerous. What I am telling you is this: it's time to start asking questions. Because too many older adults are on autopilot, refilling prescriptions year after year without anyone reassessing whether those medications are still appropriate. So today, we're going to go through 5 common medications that raise serious concerns after the age of 70, and I'll explain exactly why. 1. Diphenhydramine, common sleep and allergy medication. Let's start with something incredibly common. Diphenhydramine, often found in allergy medications and sleep aids. Many people take it thinking it's harmless, and for younger adults, it often is. But in older adults, this medication becomes a serious problem. Here's why. Diphenhydramine blocks a brain chemical called acetylcholine. This chemical is essential for memory, focus, and coordination. When you block it in an aging brain, the effects can be severe. Instead of just feeling sleepy, older adults may experience confusion, disorientation, memory problems, increased fall risk, and there's more. Research has shown a potential link between long-term use of these types of medications and an increased risk of dementia. Let that sink in. A pill taken for sleep could be quietly affecting brain health over time. If someone you love is taking this regularly, it's worth having a serious conversation about safer alternatives. 2. Benzodiazepines, anxiety and sleep medications. Next, let's talk about a class of medications often prescribed for anxiety and insomnia. These drugs can feel like a quick solution. They calm the mind, they help with sleep. But in older adults, they can be extremely dangerous. Why? Because the body processes them much more slowly. That means the drug stays in the system longer and builds up. The result? Extreme drowsiness, slowed reaction time, confusion, loss of balance, and most concerning of all, falls. A fall in a 75-year-old is not a minor event. A hip fracture can change everything: mobility, independence, even survival. Many older adults never fully recover from such injuries, and a significant number do not survive beyond a year after a major fall-related fracture. That's how serious this is. 3. Proton pump inhibitors, acid reflux medications. Now let's talk about medications that many people take every day without thinking twice. Acid reflux medications. These drugs are effective, There's no doubt about that, but they were never designed for long-term use, and yet many people stay on them for years, even decades. Here's the issue. Stomach acid isn't just there to cause discomfort. It plays a critical role in absorbing nutrients like calcium. When acid is suppressed long-term, calcium absorption decreases. Bones become weaker. Fracture risk increases. But that's not all. Long-term use has also been associated with kidney problems, increased risk of infections, potential cognitive effects. These medications have their place, but they need to be reviewed regularly. 4. Muscle relaxants, e.g., for back pain. Muscle relaxants are commonly prescribed for pain and spasms, but in older adults, they often cause more harm than benefit. These medications can lead to heavy sedation, dizziness, poor coordination, which again brings us back to one major risk: falls. They also affect brain chemistry in ways that can impair thinking and memory. And here's the key point. The long-term benefit of these medications is actually quite limited, so you're dealing with high risk and low reward. 5. Certain diabetes medications, sulfonylureas. Finally, let's talk about diabetes medications, specifically a group that can cause dangerously low blood sugar. Managing diabetes is critical, especially in older adults, but some medications can push blood sugar too low, and low blood sugar can be life-threatening. Symptoms include confusion, weakness, sweating, loss of consciousness. In severe cases, it can lead to seizures, or worse, and older adults are especially vulnerable because kidney function declines. Medications stay in the body longer. Warning signs may be missed. There are safer alternatives available today. Treatment needs to be individualized and carefully monitored. The bigger message: deprescribing. Now let's step back and look at the bigger picture. This isn't just about 5 medications. It's about a concept called deprescribing. Deprescribing means regularly reviewing medications and asking, is this still necessary? Is it still safe? Are there better options? It's about making sure every medication is actually helping, not harming, because every pill has risks, and those risks increase with age. Final message: if you take one thing away from this video, let it be this. Don't assume that every medication someone has been taking for years is still the right choice today. Have the conversation, ask the questions, advocate for the people you love, because sometimes protecting someone's health isn't about adding more treatment. It's about removing what no longer belongs. Outro. If this video made you think, even for a moment, about the medications someone you love is taking, share it with them. You never know whose life you might help protect. And if you want more real, honest medical insight, subscribe to Dr. Martin Health Tips, because the right knowledge at the right time can make all the difference. Take care of yourself and take care of each other.